Ontario's vaccine rollout was of interest to the commissioners who are examining the province's response to the crisis in long-term care during the pandemic. Last night, the transcript of Health Minister Christine Elliott's testimony was released. Experts say, according to that testimony, the government did not prioritize long-term care residents after receiving the first shipment of vaccines.
I think some of the most damning testimonies were in terms of the vaccine rollout. So, the long-term care commissioners were very clear to hit home that, we had a more disastrous second wave, as we all know. And it was revealed that by January 12th, only 13,000 of the 144,000 doses of the vaccine that had been administered from December 14th to January 12th, only 13,000 went to long-term care. And we lost so many individuals during that period that we did not have to lose had we actually prioritized long-term care.
Vivian is an associate professor at Ontario Tech University and a seniors' rights advocate. Reading through the questions from the commission and answers from the minister, she says it's clear critical decisions from vaccines to PPE supplies were not made quickly. Minister Elliott admits that the personal protective equipment stockpile was not restocked and that would have been her responsibility. The commission has heard that much of Ontario's supply of PPE was destroyed by December 2019 because it had expired. They also learned that the health table advised the province not to do widespread asymptomatic testing within long-term care, but Minister Elliott had mentioned that the Premier wanted to do it anyway.
The commissioners were very clear to target that line of questioning to both Minister Elliott and Dr. David Williams to say, well, hold on, you should have told them that this wasn't a smart move alongside all the experts who were saying this wasn't smart, because by doing this, it did everything that the experts warned. It backlogged the system and delayed the communication of the results to the homes, which then led to increased deaths. Many of these homes were being sent their results by mail. So some of these homes weren't being informed that they had COVID positive cases for a week, 2 weeks. I've heard some families tell me 3 weeks before they learned that their loved one had already passed of COVID, and only found out, a week after their loved one passed that the result came through. Why didn't they advise or institute a role for somebody whose job it was specifically to communicate to the 626 homes immediately the second you find out that there is a test, knowing that these homes were not properly prepared, knowing they didn't have enough PPE, knowing that they didn't have proper infection prevention and control training or processes in place, knowing this and knowing that because of the amalgam of those situations and those factors, that it was extra important to get results as humanly fast as possible.
Minister of Long-Term Care, Marilee Fullerton, was questioned this week as well. The transcript of her testimony will be available to read this weekend. The Commission's hearings aren't open to the public, but transcripts are posted online. What we have heard from the Commission is that the province and Dr. David Williams sent over 217,000 documents of interest last week in the days ahead of these crucial interviews.
This would appear to be a strategy to bury them in paperwork. And they had months to send this documentation to the long-term care commissioners. And it was very clear in the transcripts that the long-term care commissioners were none too impressed with this behavior by this government, because obviously, as you pointed out, there is no way you can properly vet 217,000 documents in a week, right? So that directly would impede the efficacy of their investigation or their line of questioning to, the ministers. And I cannot wait to see the case of Minister Fullerton and what her documents will look like.
Minister Fullerton's transcript will be released tomorrow at 7 p.m. and we'll have the latest on the evening news Sunday night at 11.